is a time of confusion, anxiety, excitement, and so many more feelings. The purpose of this speech is to provide information on midwives and doulas to help educate women and their spouses on the different options available when it comes to delivery time. Some women have not been informed of the different options available during childbirth. Every woman is different and should be aware of the different options available to her to best suit her needs. According to kidshealth.org, the word midwife comes from an Old English and means with woman. Midwives can be thought of from the waist down. Midwife is a healthcare professional that provides a variety of services for women. They review your medical history, they can perform gynecological exams, contraceptive counseling, and labor and delivery care. One of the main reasons women elect to use a midwife is to experience childbirth as naturally as possible. Midwives can give care in private birthing centers, the comforts of your own home, and as part of a labor and delivery team at a hospital. Depending on where you want to give birth, you would choose a midwife based on their level of education and training. A certified nurse midwife has a bachelor's degree, a master's degree, or a doctoral degree. They've completed nursing and midwife training, and they've passed the state exam to become certified midwife. They may work with doctors. Most births by a certified nurse midwife are performed in a hospital. Certified nurse midwives can use some medical interventions such as electronic fetal monitoring, labor-inducing drugs, and pain meds or like epidurals if needed. A direct entry midwife may or may not have any college. They're trained through workshops and formal instruction or a combination of the both, and they don't always work with doctors. Usually they practice in homes or in non-hospital birth centers. A certified professional midwife, certified by the North American Registry of Midwives after passing written and hands-on exams, they're required to have out-of-hospital births, and they practice in homes and birth centers. If you are concerned about needing any type of pain medication or anything like that, your best bet would be to stick with a certified nurse midwife because they are the only ones that can order epidurals or anything like that. A doula, according to AmericanPregnancy.org, is a term, a Greek term that means women's servant. Doulas are typically from the waist up. They are experienced professionals who provide physical support, emotional support before, during, and after birth, and informational support. Their goal is strictly to help women have a safe, memorable, and empowering birthing experience. Doulas can be beneficial no matter what type of birth experience you choose, whether it's medicated or non-medicated. According to dona.org, studies have shown that when doulas attend births, labors are shorter, there's fewer complications, and babies are typically healthier and they breastfeed more easily. A recent Cochrane review, Continuous Support for Women During Childbirth, also revealed a very high number of positive birth outcomes when a doula is present. Women are less likely to need pain medication, they're less likely to have cesareans, and they have a more positive birth experience. Doulas do not provide any type of medical care. They're a labor coach that's always in close proximity to the mother at all times during labor. They can provide pain relief techniques such as breathing assistance, relaxing methods such as aromatherapy and meditation, massage, and labor positions. Doulas encourage participation from the spouse as well and help him to offer his wife reassurance. Doula can step in if the father needs a break and allows him to enjoy himself and enhance his experience as well. There's also a postpartum doula, which can help you when you come home with your baby to get settled into your house. They help you bond with your baby, and they can also provide breastfeeding assistance. If you're considering a natural childbirth, or strictly if you don't want to go to a hospital, some things to consider are if you have a low-risk pregnancy, you're not diabetic, you don't have high blood pressure, you're not pregnant with multiples, and as far as you know, there's no reason for a cesarean. Both midwives and doulas are trained to recognize if something is wrong that would require medical attention, and a lot of times they do have agreements with hospitals so that if something does go wrong, they can get you to the hospital to get the medical treatment that you need. According to babycenter.com, the biggest difference between a doctor and a midwife is that doctors have the ability to intervene surgically if necessary complications should arise, such as a cesarean. With so many options available, it's time to take matters into your own hands and create your own ideal birth environment and discover what is best for your unique labor and delivery experience. Thank you.